Welcome, colleagues. Today, we're diving into one of the most critical decisions in stroke management: when to choose CT versus MRI. This decision isn't just about imaging. It's about saving lives, preserving brain function, and ensuring the best possible patient outcomes. Understanding the strengths and limitations of each modality can mean the difference between timely intervention and missed opportunities. So, let's break it down. In the high-stakes world of stroke management, time is brain, and when time is of the essence, CT is the go-to imaging modality. Why? Because it's fast, widely available, and highly effective at detecting one of the biggest stroke game changers: intracranial hemorrhage. Non-contrast CT can rapidly rule in or rule out hemorrhagic strokes, guiding crucial decisions on thrombolytic therapy. Its speed makes it indispensable in the emergency setting, ensuring that no time is lost in initiating treatment. However, there's a trade-off. CT is less sensitive in detecting early ischemic strokes, especially in the hyperacute phase. Ischemic changes can be subtle, and without additional imaging techniques like CT perfusion, crucial details may go unnoticed. Enter MRI, the powerhouse of stroke imaging. With its superior sensitivity, MRI can detect ischemic changes within minutes of onset using diffusion-weighted imaging (DWI). This makes it a game changer, particularly in cases where clinical symptoms are vague or when CT results are inconclusive. But that's not all. MRI excels in identifying strokes in the posterior circulation, areas often challenging to assess with CT due to interference from bone structures. This can be crucial for diagnosing strokes that affect balance, vision, or coordination, where early intervention can significantly impact outcomes. However, MRI isn't without its downsides. It takes longer, is less accessible, and isn't always an option for critically unstable patients or those with metal implants and severe claustrophobia. This means that while MRI is the gold standard for detecting ischemic strokes, it isn't always the most practical first choice in the emergency room. So, how do CT and MRI stack up in real-world practice? Research consistently shows that MRI outperforms CT in detecting ischemic strokes, particularly in the early phase. One pivotal study in the journal Stroke found that an MRI-first approach significantly reduced the misdiagnosis of stroke mimics and prevented unnecessary thrombolysis treatments. That said, guidelines from major stroke organizations, including the American Heart Association and the American Stroke Association, still emphasize the role of CT as the frontline imaging modality, given its accessibility and speed. The consensus? While MRI is superior in sensitivity, CT remains indispensable in acute stroke triage. So, when should you choose one over the other? Here's the bottom line. If a stroke is suspected and you need rapid imaging, CT is your best bet. It's fast, widely available, and excellent for ruling out hemorrhage. If ischemia is suspected but CT findings are unclear, MRI with DWI provides unmatched sensitivity. For posterior circulation strokes, MRI is often necessary to capture subtle infarcts that CT might miss. For unstable patients or those with contraindications to MRI, CT remains the best option. At the end of the day, the decision isn't about which modality is better. It's about which one is right for the patient in front of you. In summary, both CT and MRI play indispensable roles in stroke imaging. CT is the first-line choice due to its speed and ability to detect hemorrhage, making it a cornerstone of acute stroke protocols. MRI, on the other hand, offers unparalleled sensitivity for early ischemic changes and is particularly valuable in complex or uncertain cases. Ultimately, the decision should be individualized, based on the patient's clinical status, contraindications, and available resources. As stroke management continues to evolve, staying updated on the latest guidelines and best practices ensures that we make the best possible imaging choices for our patients. The field of stroke care is constantly advancing, and your decisions can make all the difference. Stay informed, stay prepared, and most importantly, act fast. If you found this discussion helpful, make sure to like, subscribe, and share for more insights on optimizing stroke management. See you in the next video.